You develop this mucus that you've just got to blow your nose all the time because it's like you have the worst cold there is and you've got to keep continually blowing your nose. Well, what triggers that?
Sinuses have cilia which help clear mucus, and it's normal for that cilia to clear the mucus and for it to drain normally to the back of the throat into the digestive tract. But with allergic inflammation, you just produce a lot more mucus. It may be thicker and more difficult to clear, and that's what you're feeling is that drainage that would normally be there, but just more and more difficult. On the eyes, because the eye symptoms can be particularly bothersome. And using a saline nasal spray can also be helpful in loosening the mucus and helping get rid of some of those irritants.
Well, you guys call these intranasals and so forth. All right, explain what we have here and what these are for, because I'm dealing with these in the middle here, and I don't know what they are. I've never seen this stuff.
Art, a lot of times what happens is people who come to see an allergy specialist has not seen really great results with some of the over-the-counter medicines that Ira was talking about, and in addition to antihistamines, maybe decongestants as well, or they're having side effects from those medicines. Then we move on to some of the prescription medicines, and one of the first lines in prescription medications is intranasal steroids.
These are sprays that are going to go in the nostrils. I'm just assuming
Absolutely.
Here these are all sprays
Right.
Into the nostrils.
Right.
All right, now I'm just being the antagonist here because,
Sure.
Again, I suffer. And I know Dr. Rob Danoff, who we've had on this program
Right.
before, he's a big fan of these. These are these rinses.
Right.
What's this? Sinosense and
Right.
Nelly Med.
Right.
What?
So these are a great non-medication alternative to treat your allergy symptoms. The advantage of these is these are available over the counter. They contain salt packets, and these contain a little bit of non-iodized salt and a little bit of baking soda. You put one of these packets in and mix it with some warm, sterile water, and the idea is to literally flush out that mucus that's causing the congestion and those allergens that are driving that inflammation.
That seems awfully, messy for one, and tough. I mean, you're going to actually take this and flush it out of one nostril through the other nostril.
Right.
And
there's some, you're right, it takes a lot of convincing to get people to use it. But people have been, maybe not in this fashion, but been doing the same thing for centuries.
But effective, though.
Very effective, and it comes in different delivery devices. So if one doesn't work for you, maybe another will. On this, you can see an image of a teapot, and that's where the neti pot gets its name. This is a more modern design, which is just supposed to make using it a little bit easier. You can lean over the sink and, again, literally flush the nasal passages.
Again, you got to do what you got to do when you're suffering and so forth. And the bottom line is you got to go see your allergist to figure out which of these is going to be the best practicality. There's a lot of stuff on the table here. There's a lot of stuff in the drugstores. And look, go see the doctor if you need extra care. See the pharmacist. They can talk to you about this, but you're going to need more than just these. This is just to help you when you got nothing else. Thank you, Doc. I appreciate it.
Thanks so much, Art.
See you again next time on The Report.